This is Endocrine lecture, the Acute and Chronic Stress. This is first lecture in the series for the endocrine system. Starting the topics of the endocrine system, I want to talk about just the differentiation between the primary endocrine organs and secondary endocrine organs. I'll tell you what that is in a second. The types of hormones, water-soluble and lipid-soluble. The difference between them is that water-soluble are very fast-acting, and the lipid-soluble are slow-acting, require a carrier protein. And to do this, starting out with the endocrine system, it's best to describe acute and chronic stress, and then we'll go through, starting from the top, the endocrine system. First question, how do hormone signals travel? Do they go through nerves, like axonal transmission, or do they travel through the bloodstream? And the answer, the difference between hormones and neurotransmitters are that hormones travel through the bloodstream. So the endocrine system with endocrine cells, like the thyroid hormone being secreted by the thyroid gland, secreted from these secretory vesicles directly into the bloodstream. And then there's also for instance, the hypothalamus, neurosecretory cells that produce hormones that get deposited directly into the vascular system that way. So in contrast, the nervous system, they deposit their signaling packets, neurotransmitters, down the nerves that pass either through synapses that are shown here or on motor end plates. So true or false, all of these organs are either primary or secondary endocrine organs. Look at all of them. The answer is true, all of them. The trick is the heart. The primary endocrine organs are shown here. The hypothalamus, pituitary, pineal, thyroid, pancreas, adrenal, parathyroid are all primary endocrine organs, meaning that their primary function is to produce hormones. In contrast, the secondary endocrine organs have another job first and foremost. For instance, like the gonads produce, their first job is reproduction, to sperm and ovum, and kidneys, waste, heart, pump, muscles, movement, intestines, digestion. But they all produce hormones as their secondary job. So a few of these examples, as I mentioned, the kidneys, for example, will produce erythropoietin, among other hormones. The heart is interesting. We'll talk more when we get to the cardiovascular system. But as the heart detects large blood volume or too much blood volume, the stretch will initiate the response of the atria to secrete atrial natriuretic peptide, and that will act on the kidneys to get the kidneys to secrete excess water. And adipose tissue produces leptin. Next question. There are 3 endocrine organs in the brain. How many of these are inside the mammalian brain? A1, B2, or all 3? And the answer is all 3. Remember these 3, I divided these into the different parts of your brain, the 3 major segments. The reptilian brain being your brainstem, your heartbeat, you breathe without having to think about it. The oldest part of your brain is the reptilian brain. Then the next part is your mammalian brain. That's the one that does so incredibly much. But it is responsible for all this hormone production. So all of these 3 are located smack dab here in the middle part of your brain. The thalamus is directing information flow to the hypothalamus, pituitary, and the hypo, meaning below, hypo is below the thalamus. And the pineal gland is just this little guy here sitting behind all of it. So let's talk about stress to help you understand what stress is and also to explain the endocrine system. There are two types of stress that cause hormone release. Which type of stress sets off the sympathetic nervous system? Acute stress or chronic stress? So the first type of stress, you actually see the snake. And the second type of stress, the example is the thoughts. What if I do see a snake? And the answer is acute stress. It sets off the sympathetic nervous system, which in turn releases the hormones of acute stress, adrenaline, and which is epinephrine, and norepinephrine. So acute, you see it, everything is happening. I'm showing these dilated pupils because at the same time everything is being stimulated, your pupils dilate. Chronic stress is the worry type. You also have other stress imbalances, like if your blood sugar gets low, but this chronic worry is this type of stress that can be initiated not only from internal homeostatic imbalances within your body, but also you can initiate chronic stress from just your thoughts. So those thoughts actually get taken into the thalamus. Actually, everything comes into the thalamus. So the thalamus receives input, special senses like the vision, see the threat, initiates this sympathetic response. And then thoughts from the cerebral cortex also come to the thalamus, which initiates this chronic stress response and cortisol release just by thoughts. So you have two types of hormones, a fast-acting and a slow, represented by the fish and the turtle. Which type is involved in acute stress? Is it the fast but short-acting hormone epinephrine or the slow, long-acting hormone cortisol? And the answer is the fast-acting. Just think of anything that's fast and short-acting is an acute problem. And I depicted the acute stress hormone as amino-nemo. Call them that because of an example of the different types of amino acid-based hormones. So amines, thyroxine, peptides, proteins, they're all water soluble. They're fast to work, but they're quickly gone. So what system is activated when you're acutely stressed? This is testing your short-term memory. The endocrine system, the nervous system, or both? So the answer is both. Everything gets activated. So an acute stress response needs everything to happen all at the same time. Your sympathetic nervous system gets activated, and at the same time, hormones are also being released. So if you look at the sympathetic nervous system, it's coming down, being the transmission is coming through the thoracolumbar part of your spinal cord, synapsing with this sympathetic chain, and all of these impulses are going to everywhere in your body, showing your pupils dilating, your mouth going dry, heart beating fast, breathing faster, but also some of these nerves are going directly to the adrenal glands. And with that, the nerves that innervate the adrenal gland stimulate the adrenal medulla. It's the interior part, middle medulla, to release epinephrine and also releases norepinephrine in addition. So you have a threat, sympathetic nervous system is activated. In response, the body is able to either fight or flight, and you get a release of adrenaline, which is also called epinephrine. So why are water-soluble hormones so short-acting? A, to prevent too much stress on the body, or because they're small? It's true that they're small, but the most important thing is that you get such a massive effect on all organs of the body that they need to be gone quickly. So a chronic acute stress would be terribly exhausting. So the organs responsible for both acute and chronic stress are these adrenal glands. They're also called suprarenal glands because they sit atop the kidneys. They're not part of the kidneys. That's just where they sit. And in this cadaveric specimen, you see the adrenal glands right here sitting atop of the kidneys. So we talked about the medulla holding amino-nemo, but there's also a cortex that supplies another, the other stress hormone, cortisol, and also the cholesterol-based hormones as well. So for acute stress, it's signaling the release of these short-acting hormones, epi, norepi, fast, short-acting, and chronic stress signals the release of the hormone cortisol, which is slow and long-acting, as depicted by the turtle with a cholesterol shell. So the other hormones that are produced in the adrenal cortex include glucocorticoids as well as mineralocorticoids. These are all steroid hormones synthesized from cholesterol. They are not soluble in water, and they require a carrier protein. Because they're not soluble in water, to travel through the bloodstream, they have to rely on things like albumin that's produced by the liver. And the way cortisol is produced is through this HPA axis, hypothalamic pituitary adrenal axis. So the signals are coming from the thalamus, and the hypothalamus is signaled to release corticotropin releasing hormone, which signals the anterior pituitary to release ACTH. And that hormone travels through the bloodstream, lands and stimulates the adrenal cortex to produce cortisol, the chronic stress response. These are the acronyms for CRH and ACTH. So stress is released, stress releases cortisol, not only with chronic worry, but things like fasting when you have a low blood sugar. It can also happen if you stand up quickly. So these are body imbalances. The intent of the body was not to have chronic elevated cortisol, but to fix the problem. So for instance, with low blood sugar, your body is stimulated to release cortisol, and cortisol stimulates gluconeogenesis. Gluco means creation of new glucose. So in a state of fasting, you will create glucose from stimulating the liver to create glucose to get your blood sugar up. But also with that chronic worry, that sustained chronic worry and chronic low-level stress, you'll have a chronically elevated blood sugar. Let's go through a couple disease presentations. What happens if you lose your adrenal glands or if you have too much cortisol production? So adrenal insufficiency is presented here as Addison's disease. It has a profound, this is a very life-threatening situation. Notice that with people that have insufficient adrenal hormones, they have postural hypotension, which means that if they stand up too quickly, their blood pressure can't equilibrate. They have chronically low blood sugar because they can't create glucose from the liver. And the other end of the spectrum is Cushing syndrome, too much cortisol excess. And that can happen from tumors of the adrenal gland, but also we saw a lot in patients that were on high dose prednisone, for instance, for allergies, severe asthma, rheumatoid arthritis, people that were on these steroid hormones for long periods of time before other better treatments came along. And you see this predominance of visceral fat deposition right around the viscera within the abdomen. And the deposition is so quick that it creates these stretch marks. This is an example of a woman before and after the onset of Cushing syndrome. And the long-term complications of having these high cortisol levels are hypertension, and of course, because they have sustained elevated glucose, they develop diabetes, and also with that as a secondary effect is heart disease. So the long-acting steroid hormones are these three: cortisol, glucocorticoids, and mineralocorticoids. Cortisol is the one released by long-acting stress. But they're there for a reason, for when your blood sugar gets low, for your metabolism. Like I said, it also helps reduce inflammation. So if you're have a reaction to poison ivy, you may be put on a steroid dose pack that quickly helps you get rid of the reaction of the poison ivy. So it's great for giving homeostatic balance of your body, but it's not intended to be a chronic, long-term high blood levels of cortisol. So worry is what you'd call a maladaptive stress response. And having that chronic worry state leads to the prediabetes, hypertension, and heart disease. What is the purpose of the endocrine and nervous system? A, safety, survival, growth, reproduction. And I'm hoping you're going to say all of these are correct. So we use these stress responses for survival. Acute stress threats outside the body. You see something outside like a bear chasing you, releasing epi and norepi. Chronic stress are intended to take care of bodily imbalances. So inside imbalances, you stand up too fast, you're hypoglycemic, and then of course chronic stress of the worry types are the perceived threats. So your behavior determines how long you survive. This is a movie, The Revenant, with Leonardo DiCaprio, who comes across a bear in the woods. And so he's trying to fight off this grizzly bear. And it's an interesting part of the movie, because at one point the bear just is on him, beating him up really badly. And finally, he's laying there still, and the bear turns around and starts leaving. And then Leonardo DiCaprio reaches up, grabs his rifle, turns over, and as soon as the bear sees that he's not dead, the bear comes back and starts attacking him again. And Leonardo DiCaprio is making the decision, fight or flight. And the bear, in my mind, is thinking, play dead, stupid. So when they did a study, they've done lots of studies on how people respond to stress. The Survivors Club, great book by Ben Sherwood. They found that 80% of people freeze or do nothing, which actually is not all of a bad thing if you're in a situation where you're like can do nothing. And 10% of the people make the problem worse, like they escalate the problem. And then 10% survive by doing the right thing. These are like looking at people on sinking ships, for instance, or people in a burning restaurant. They'll find a number of people that will sit frozen at their dinner table while the restaurant is burning around them. And 10% of those people will actually do the right thing. Now, a lot of this comes from learning and memory. And all of this is connected within the middle part of your brain, actually the mammalian brain. So the amygdala is where your emotions are. It's connected to the hippocampus, learning and memory. And then this becomes attached to the anterior cingulate gyrus. That's the part of your prefrontal cortex that determines your behavior, your self-control, and your empathy. Things that you can actually work on to practice. And some of this gets kind of sidetracked with things like PTSD, where you've been exposed to very emotional situations. And then when you hear like this, if you've been in war and you hear the sound of guns, and they're always associated with, that crack sounds always associated with a bullet or a bomb. If you hear a car backfire when you're back in a situation where there is no fighting, that sound can just initiate the behavior directly of throwing yourself to the ground. So this is part of the thing that they try to block with treatment of PTSD. So in summary, hormones are released during stress. Acute stress is that sympathetic nervous system response that activates the adrenal medulla to release epinephrine and norepinephrine. Chronic stress is the either worry or imbalances within the body. The hypothalamus releases corticotropin releasing hormone that stimulates the anterior pituitary to release ACTH, which stimulates the adrenal cortex to release cortisol. So our challenge as humans is to learn how to manage these stress responses. This is just a funny book about how we can learn how to be more like our mammalian brethren. So zebras react to a threat, then they go right back to eating. They don't dwell on the past, or they don't worry about the future, and they don't worry. They've seen the lion, the threat is gone, and they're not constantly sitting worrying about the lion, unable to go back to eating. So any questions, please leave comments in the comment section, and subscribe to the channel. Also, please stay tuned for the next segment, number 2, about how to manage chronic stress, how to measure it in yourself, and how to manage chronic stress.